I'll come maybe 10 before.
Yeah, I mean, you're all set up, so
So I'm okay.
Whenever, yeah.
Okay, great. See, good.
you'll be fine. Not exactly. That one's there. Yeah.
Hi,
Here.
Very fun.
Hey, how's it going? Wanted to say hi. Good to see you. Not a big thing, I don't know what that's. Okay. Good to see you. How goes the battle? How goes the battle? No. Okay. Let's see, is there a peak in sight or that?
Maybe, especially like the conference is getting more inspiration because I feel like I've been very isolated in my ideas. For a long time, and trying to constantly, like, brush it and stuff.
Yeah.
It's exhausting sometimes.
Yeah.
Really Feel nice to be energized.
Yeah.
We did have two people, so allergy celebration to see. 80,000 speed and see their plans. The working part of it.
It's in the office. Leases.
Yeah, I'm trying to just have a career. Yeah, we have been.
Excuse me, hello, presenters, speakers?
No,
Hi, yeah.
Yeah,
Are you the chair?
yeah,
So I'm gonna throw a curveball at you if it's okay.
what do you mean, sorry?
Are you ready? Something non-traditional.
Okay, that's
So
fine.
the second and third speakers,
Yeah.
our work's related and joint, so and we had it happen to schedule us back to back. And so we're just gonna combine the two presentations and hand off in the middle, if that's okay.
No, but here's.
It's all set. Yeah, we're good to go.
I met you online at Dale's class.
Oh, that's right.
Because of it, I remember you because of that, especially because it was online.
Yeah, that's great. I told Dale I'd come down this year, drive down, the star of the view.
Is he still doing it?
Yeah, yeah, and he's around, he's here, and he's coming to the session.
I didn't know.
Yeah, I just met him.
Yeah.
A few minutes ago, and he said that he's coming.
Yeah. Really good. I'm traveling.
You are presented to?
Yeah, it's Arumugam, the last one.
I'm sorry, but you're wrong day here, sorry. Year.
Yes,
Irving.
the last one.
Okay, how do I pronounce the name?
You can say Dr. AK.
Yeah.
AK,
AK.
Arumugam Kalimuthu, that's what the, yeah,
Okay.
that's it.
Arumugam Kalimuthu.
Kalimuthu.
Kalimuthu. I'll try my, if you don't mind, I'll try my best.
Yeah, from an NGO from India.
Yeah. Mine, not proper, try to pronounce it, without knowing. How would you pronounce mine?
Carlos,
Yeah.
Muta,
Yeah.
Nonis.
Yeah. 9 out of 10. That is so hard sometimes.
Yeah.
Your presentation there, right?
Yeah, already.
Okay.
Yeah, yeah, we're hiring social determinants.
So, are you, okay, do you wanna handle the Q and A or want me to handle the Q and A? I mean, after finish presenting?
I can ask any
Okay,
questions.
yeah, okay, so you,
You know,
so, quick question, sorry.
Yeah.
So, a quick Q and A, so, because you're gonna make a mix of.
yeah, so I think the plan is you get 10 to 12 minutes for a presentation. We're gonna try to get both at 20 and then leave a whole good Q and A at the end for the
Okay.
two together.
Of the two together,
Yeah.
okay.
Because it's like same outcome, two different interventions, same background, so rather than give them the same background twice, the same crowd.
Mhm.
If they put us in separate rooms,
So it's a Joe Cook.
easier to,
Okay.
And he's not gonna keep people awake.
It's the last.
Yeah, Thursday, I feel like everybody's.
It's last day and last, event of, the
That's what they always
conference.
put us. But yeah. Exactly. Oh, so, yeah, I mean, so the situation too, right, you know, there got an interview, which after I started.
Okay, great.
That's good, yeah, that's kind of big, huge. But yeah, it's not perfect, right? Not a PhD program, I did the social science and then my interdisciplinary, yeah.
Can you do this with the same?
I'm not.
Yeah.
Cool, but so it's not like I can set up a shop. It's just.
Just go, use the and. One presentation first, so for this.
I have the resources, I-
You so 20 minutes,
Yeah,
give them 20 minutes for both of them. No, the sum, yeah, together, so they will manage this 20 minutes. Okay, so that's the only.
I will show them after.
Yeah, 17 minutes for the 3 minutes, so let me just. Start again, Dave. So she will still be the timekeeper.
Okay.
So she will show this time of 3 minutes when there is 17 minutes presentation. Is that okay? Or you need some moment before what to.
No, that's good.
That's good,
Yeah.
okay.
Or you can, after, show me when it's, I don't know, that's. the
Yeah,
way-
yeah.
We'll do 3 minutes and then 1 minute.
Yeah, when there's 17 minutes, yep.
Yeah.
We're gonna try to keep it crisp.
Mhm.
So for other speakers, it's 15 minutes.
Yeah, 12 plus 3.
Yeah.
Okay.
10 minutes, yeah.
Huh?
10 minutes.
12, and then you have 3 for Q&A. If you spend the 15, it's not gonna happen.
No, yeah. Then mine
But
is long.
usually when we do it, this, there's always 10, 15 minutes at the end, and I ask for everyone to the desk, and it usually works. So we get present for everyone. So that's how it's being played out the last 3 days.
Yeah, yeah.
That's one of these guys.
It is a job, one of the drawbacks of this.
Yeah. And our student body is very good.
Yeah, I remember.
I mean, that's not a range.
Yeah. There was something I was saying, yeah, I teach them. No, like you just spend money to buy our class. Yeah, or just like write a grant, and you write, no, $7,500, and they add French note, it ends up being $16,000, $500. So you just write it, do a grant, $500, yeah. Yeah, so. I'm getting expensive. Oh, yeah, it's crazy though, but you know, I'm bringing in $60,000 to fire course, and they're trying to only pay some $500. Big deal for them.
Yeah.
They'll let me rent out.
I mean, I knew that.
It's kind of crazy. No, but it's great. I don't think everybody's there. Kindergarten, getting.
It's like from the Swift in the plane.
Yeah, the mobile septic treatment, your name. Mobile septic treatment. Collect the sludge. Then we convert them.
The house. It's not the treatment plant.
No, treatment plant. It's a treated sludge. It's a treated sludge.
But the household level. Or.
No, it's a treatment plant and we have a mobile septic treatment. So I'll be showing that.
Okay, cool.
So maybe we'll extract sludge from there.
You know, I did my master's on flood management 20 years ago.
I say, okay.
And never work with that anymore. But most of subjects are.
Now it is a, yeah, that's a way of, what they call that, that's a trend now everywhere. It is like management.
Yeah, mine at that moment was from Brazil and Rio had programs that they built 5 or 6 large wastewater treatment plants.
Okay.
And they didn't plan for this land.
Oh.
So they didn't know what to do.
What to do with the
Yeah. So my project, master's degree in England was, okay, so looking at the whole problem, not one treatment plant only, but all this group of all the plants, what should be the best solutions for handling the sludge from there, you know?
Yeah.
10 years ago.
I did my master's from University of Surrey.
What?
University of Surrey.
Mhm.
Guildford.
Ah,
Yeah.
yeah.
I did.
Yeah, yes. Oh, which year?
2002.
My gosh,
We make real.
I think 2001, we're 1 year difference.
Yeah.
Wow.
Small world. So much bright light. Wow. All it was there. Yes. Such a small world.
I am the
Yeah, I did mine, Vila Sabera.
Yeah.
Survival.
Okay,
Because it's
Brian was my,
Huh?
Brian.
Brian was a survival.
Yeah.
Oh, yeah. Wow.
That's right.
Wow.
Yeah.
I stayed there, Battersea Court, Battersea Court, that hostel,
Okay.
there I stayed.
Well, I live in, it's the one in front of the hospital. Pillai, you
Uh-huh.
know, it's in front of the Royal Hospital.
Correct, yeah.
You pass Tesco, oh, I've never been there since then. No.
Just.
But, wow, what a coincidence.
Yeah.
Just 1 year difference.
Yeah, just 1 year, yeah, exactly.
So you probably met one of my colleagues, Caetano Doria.
Welcome was there.
Yeah, Caetano was my colleague, the master degree, and he stayed for the PhD.
Yes.
You know?
Yeah.
He's in
Gaetano
Canada right
was-
now.
I see.
Yeah. That's so cool.
Gaetano helped me in the lab.
Yeah.
Gaetano helped me in the lab or.
Wow. Wow. Yeah, oh, good time. That's just remember someone else, but yeah, stay there. It's important. The professors. Yeah, we need to, I like that.
We did a PhD. I think flow and filter.
Yeah. It's good time.
Very nice.
Some dish back for this year, 10 years later, you still remember me? No, I'm Carlos, I'm the moderator here. Yeah.
Did David tell you?
Yeah, yeah, I know, I know that your plan,
Thank you for your.
your plan just to dominate, to run the world, I know.
That's right.
Who's that, man?
Yeah.
Christmas, no, Christine. Christine? Nice to meet you, Carlos, I'm the moderator here. So, yeah, quick question, do you wanna handle the Q&A yourself or want to do handle? Okay, things we can add. Okay.
I was just gonna point out whoever.
Yes. She'll be the timekeeper. 12 minutes, 3 minutes remaining. So the 3 minutes. And then one, and then. Okay,
For the bonus, right?
for the 12, yeah, and then you have 2 more minutes.
Okay. We're working on it.
Yeah.
Yeah.
Sorry.
Next year.
No, it's just because. We acted in we're in the same section and right next to each other. But the introductions. It would have been, yeah. Now we can say to the meat.
Economies of scale, I think.
We almost started. Water.
I'm in it.
I don't know. Then what I hear. Maybe. What is your?
In general.
Good afternoon, everyone. Thanks for being this session. My name is Carlos. I'll be your moderator here today. And just for everyone to be sure, we are in the Azelia room and they'll talk about economics, finance, and policy. I always try to people double check that because my case, I always get the wrong room, so just for you to see that you're in the right room. So first presenter will be Christine Fu, and she is going to talk about are water and health investments reaching impoverished households? It depends on how poverty is measured. Christian, please.
Thank you, Carlos. And just to make things interesting, I did change the title of the slide, so you are in the right presentation. My name is Christine. I'm a PhD candidate at Stanford University, and my research helps decision makers identify the types of water and climate investments that have the biggest potential to alleviate poverty. And because I study that, something I think a lot about is how should we be measuring poverty in the first place? If you ever asked yourself this question, you'll know that there are many different ways to approach this. One way is just to think about consumption expenditures. We can set a minimum number of calories that we think is necessary for survival. We can cost or calculate how much it would cost to procure those calories. And then we can classify households based on whether their income is above or below that threshold. Alternatively, we can take a more multidimensional approach to measuring poverty. Instead of just focusing on the monetary aspects, we can think about health and education metrics. We can think about their access to basic services like water and sanitation. We can also let households themselves decide where and how to set the poverty line. Increasingly, decision makers are thinking about including participatory methods where communities collectively define what poverty means and looks like based on their lived experiences. Now, if you're a nonprofit organization trying to target individual households for your programs, or if you're a government agency trying to assess how effective your poverty alleviation programs are, or if you're an academic like myself, just trying to understand what your primary outcome variable should be, you are probably asking yourself at this point, how does one choose which poverty measurement approach to use? And does it really matter? So we designed a study to deliberately answer these questions. We partnered with organizations in Ethiopia, Ghana, and Uganda, and we surveyed over 16,000 randomly selected households. In our standardized survey, we included questions to analyze households based on 4 poverty measurement approaches. We use the DHS Wealth Index, which assigns every household a raw score based on the assets they own. We included the Poverty Probability Index, or PPI, which assigns households a probability of living below the poverty line based on 10 household characteristics. We also included something called Krishna Stages of Progress, which is assigning households a binary poverty status based on the number of well-being milestones that they've achieved. And these well-being milestones were determined by Professor Krishna and his team down the road at Duke University after going through a participatory process with 35,000 households across the world, in which he found that the first 4 stages were unanimous. So once household had enough food, enough clothing, the ability to send their children to school, and a roof over their heads, these households were no longer considered to be poor by its community. And the last thing we included here was regular expenditures. So we asked households how much they were spending on food, airtime, and transportation. With our data, we then assigned each household 4 relative rankings based on these approaches. And the beauty of this is that we can then compare how these different approaches rank the same household to see the level of agreement across the board. So let's start off by comparing the DHS Wealth Index with regular expenditures per capita. It seems reasonable to expect that a household with a lot of assets is also going to be a household that spend more money on their daily expenses. If that were to be true, we're going to see a coefficient in the +1 part of this graph. And given that I haven't included that number, you probably have guessed that's not what we see. So when we look at all of the rural households across the 3 countries, we actually see a negligible correlation between these 2 approaches as indicated by this gray square. We see similar results when we look at urban households across the 3 countries, and when we disaggregate the data by urban and rural subsamples in Ethiopia, Ghana, and in Uganda. We see similarly weak correlations when we compare the PPI versus the DHS, and when we compare the PPI versus regular expenditures. So in our sample of over 16,000 households, we see almost no agreement in how these different commonly used approaches measure poverty. Now, the skeptics in the room at this point are going to say, Christine, these approaches were developed to measure poverty. So instead of comparing how they compare different households across the entire sample, maybe you're only supposed to be looking at their performance among the bottom 20%. I don't have the time to show you the data today, but when we replicate the analyses for the bottom 20% and bottom 1% of the population, the results don't improve the picture. We still only see negligible and weak correlations. Okay, so we've established that the approaches rank households differently. At this point, you should be asking me, well, by how much? How big are these differences that we're talking about? Are we talking about 1 to 2 percentile differences or something much more substantial? So on the y-axis, you're going to see the absolute percentile differences and how the various approaches rank the same household. So for example, in this particular instance, a rural district in Ethiopia, the median difference in how the DHS versus the regular expenditure ranks the same household is about 25%. Meaning, if you have a household that's at the 50th percentile, according to the DHS, that same household could be at the 75th or the 25th percentile based on its regular expenditures. That's a big difference, folks. And it's what we see consistently with other districts in rural Ethiopia, in rural Ghana, in rural Uganda. And when we look at the PPI versus the DHS, and when we look at regular expenditures versus the PPI. And this isn't something that we're just seeing with rural households. On average, urban households are also being miscategorized by an entire quartile. So why should you care about this? Well, let's first review what we just learned and what we've observed so far. From our data, it's clear that the different approaches rank households differently. This is true for urban households, for rural households, for the whole population, the bottom 20%, and the bottom 1%. And the differences that we're talking about aren't trivial. They're big, 25% on average. So why should you care about this relates to this example I'm going to share here. Let's say you're an organization operating in urban Kabarole in Uganda. You're rolling out a program and you want to target the 10 lowest and most vulnerable households in this district. And you start off by using the DHS Wealth Index to identify those 10 lovely households we see in green. But what if you were interested in using a different approach? Based on our data, if you use the PPI, you would only see one overlapping household with the target set you identified with the DHS. And you would see no overlapping households if you use regular expenditures or Krishna stages of progress. In other words, your target set of households are going to be completely different depending on the measurement approach you use. So the government of Ghana has firsthand experience with this. When Ghana's LEAP program changed its household selection process from a participatory approach to using socioeconomic proxies, they saw that their inclusion error decreased from 62% to 36%. So this isn't just an interesting intellectual problem, it has real cost implications for programs and operators that are trying to target vulnerable households. The other question I would ask at this point is, why is this happening? Well, fundamentally, these four approaches are measuring different definitions of poverty. And when I say definition, I'm talking about the core idea or the underlying conception of poverty. That's very different than the metric or indicator we're using, which describes how we're going to measure that idea. So an example, let's say we're interested in measuring intelligence. And let's just say we're interested in using the SAT scores to do this. Everyone in this room and online can agree that that's not the best metric to use, but stay with me. If we were trying to classify individuals based on intelligence, let's say for college admissions, we probably might set an SAT threshold of 1,000. Again, folks, I'm Canadian. I've never taken the SAT. I don't know what the right number is set. But irregardless of the number, we would never say that the definition of, should someone check that?
It's just
Great, we're gonna be okay. We would never say that the definition of poverty is having an SAT score of 1,000 or higher, right? In other words, we would never equate the definition of poverty with the indicator or metric that we're using to measure it. That's kind of exactly what we're doing with poverty. Sentences like these describe how we're going to classify households as living above or below the poverty line, but they tell us very little about the conception of poverty that the UN actually subscribes to. And I'm not trying to pick on the UN. Every major development organization does this, where they provide a definition that's really just an indicator or metric. And the reason that's important is because if you and I are going to have a debate about whether your metric is better or whether my metric is better, we need to at least be able to articulate in words the idea that we're trying to capture in the first place. So let me show you one more example of why it's important to align the definition with the measurement approach. This is the DHS Wealth Index that you're looking at for Ghana. And in the DHS Wealth Index, livestock ownership is assigned a negative weight. So with everything else held constant, every additional unit of livestock you own means that your index score goes down. This was really counterintuitive and still is for me today. And when my team and I first saw this, we were completely perplexed. Why was the DHS Wealth Index penalizing households for livestock ownership, where many of us in this room would associate it with a positive sign of family wealth? It turns out that the DHS Wealth Index was designed to categorize households in a way that allow us to observe differences in health outcomes and access. It was never meant to be used as a socioeconomic proxy, even though that is what it is widely used for today. So if we think about the DHS as an indicator of health, then the negative weights are arguably valid. Livestock are more common in rural areas, and access to health services are almost always less available in those regions. But if we think about the DHS as an indicator of household poverty, then this treatment of livestock is both counterintuitive and inappropriate. So going back to the two original questions I posed at the original or earlier part of this presentation, how does one choose which poverty measurement approach to use, and does it matter? Our results suggest that it does matter. The approaches that we choose to measure poverty directly and meaningfully impact who gets classified as impoverished, and therefore who has access to our policies and programs. And in terms of how we choose, I hate to say it, but it does depend, and it depends specifically on your definition of poverty. I'd love to thank my co-authors, my research assistants, everyone in these various countries that made this possible, our funders, of course, and the households who agreed to participate in this study. Would love to answer any questions. Thank you for your time. Yeah, go ahead.
One of the things I was thinking about with these indices are they all based on quartiles and not looking at like poverty with all relative to poverty? And how do you think about that in choosing?
Yeah, that's a great point. So we actually had a mix here. I would say the DHS is relative, or a lot of these a lot of these different approaches give you an option. The PPI is an absolute measure. The DHS is a relative measure. Krishna stages of progress is absolute, and regular expenditures can be absolute or relative. But to your point, it really depends on your definition of poverty, right? So if what you care about is within this district, do we have enough households that meet a basic standard, which I'm defining as X, then you would want an absolute. But if you're saying I'm working within this district and I care a lot about relative poverty, so individuals that are systematically being excluded for some reason based on their social standing, then that's where the relative measures are going to be a little bit more relevant, right? But that's kind of a organization mission / objective that you have to set in the beginning before you go out and find something that can serve that purpose.
Christian, thank you. Well, you have more to think to you compared to the end with call everyone to the desk here at the end, so hold your questions and you have the opportunity to ask the question later. Okay, so now we're gonna have two presentations that will go together, and they will be sharing the stage. So the first one, nudging customers to pay their water and sewer bills, a field experiment in Nairobi, Kenya by Joe Cook. And together with David Fuente, who is going to present about does debt forgiveness improve water bill payment? A field experiment in Nairobi, Kenya. So there will be two presentations together. At the end, you can ask questions for any of them. Okay, go ahead.
Thanks so much. Yeah, we changed the program a little, so you get 2 for 1, same background. 2 studies implemented in Nairobi, Kenya, not as part of the same study, but as 2 different experiments, but with the same objective, improving bill payment among customers in Nairobi. So this crowd is well steeped in the SDG for water and sanitation. The thing I think is interesting about this is, when we started this back in 2015, the World Bank got together and tried to estimate how much it would cost to meet the SDGs, right? We all know we're woefully behind, right? But they estimated at the time to be $100 billion per year, right? So that had the economists and the finance people licking their chops, right? And so there were 2 challenges. One, many of us have spent time thinking about, and that's getting the price right. And I personally have spent a lot of time thinking about that. But the thing I think many of us have ignored is the fact that we also have to collect revenues, right? So we not only have to get the price right, send a signal to conserve water and recoup costs, but also make sure that utilities are doing a good job collecting revenue. So we're going to talk about that today. 2 reasons why utilities need revenue. When you talk to folks who don't spend time staring at balance sheets of utilities, I think we get focused on the need to fund operations and maintenance, right? But part of the story is also not only funding capital expenditures, but attracting finance, right, for capital expenditures. And to do that, utilities need a stable revenue stream that they can go out in the market and sell debt to, right? In the US, water market debt's usually rated AAA, very fantastic investment. Not the case in many low and middle income countries, but a reason why we need to pay very careful attention to revenue and bill payments. So in the past, right, not so long ago, the way the utilities did that is that they had a threat of disconnecting customers who didn't pay their bills, right? So they sent people around, if you don't pay your bill for several months in a row, your water's cut off. And that's how we prompted bill payment. That's changed, and I think it's been changing at a rapid rate with the increase in the human right to water and sanitation. There's less political will to disconnect non-paying customers who may or may not be poor. And I think that trend has been accelerated with COVID-19, where cities and states and countries across the globe put a flat out moratorium on disconnections. And many politicians and utility managers have found it hard to go back and reinstitute disconnections. But that raises a big puzzle for us in the water sector, right? If we don't have a way to disconnect customers from water to get them to pay their bills, what do? And we lose a really strong incentive, a lever we have as policymakers. So we started thinking about this, trying to get a sense of how big of a problem this actually was. I don't think we have a very good sense of how big the problem is. We've talked about this in the context of non-revenue water to some extent as a community. But just a few data points. South Africa, from a study in 2015, there are about $4 billion in arrears in Cape Town alone. In Kampala, Uganda, we're doing current work there. 57% of customers, residential customers, are behind on their bills. In Nairobi, 60% of customers are behind on their bills, right? So this is a much larger problem than I initially thought it was. And this has motivated the work that we're going to present today. But there's lots of different reasons people might not pay their bills on time. My assumption initially when I started working on this was that it was because people didn't have money, they were poor. But recent field work that we're kind of working on shows that it's much more varied, heterogeneous. It's less than 25% of people I've surveyed haven't paid their bills on time because of affordability issues, either chronic or episodic. So it's more complicated. But the question I'm interested in, Joe's interested in, here my colleagues at Nairobi Water and the University of Nairobi, is if as a global community, we think we're moving away from disconnecting non-paying customers, what can we do to compel on-time bill payment? This is a real part of the challenge for financing the sustainable infrastructure transition. So I think it's a big challenge we all face. And so 2 questions we're going to talk about here. is can we use kind of relatively simple, low-cost SMS reminders to compel on-time bill payment? So that's one, that's the first study that Joe's going to talk about. The second study I'm going to talk about is can arrears forgiveness, debt amnesty, be an effective tool for prompting on-time bill payment. So I'm going to hand it over to Joe, talk about the logistics of the first study.
Thanks, David. So yeah, so as he was previewing, this first study is going to be, can we use simple information treatments nudges? So this is a partnership with the Nairobi water utility that David has spent many years of blood, sweat, and tears building that degree of trust to work with them, that they were willing to both share billing data, but also to partner with us in an experiment that would be both useful for the broader WASH community, but also quite useful for them to know whether this really works. So it's going to be a standard RCT. We randomized who got these messages from the billing records. We stratified on water use and their existing level the 6 months before we did the study, their existing level of water debt. So that will be an important thing we're going to come back to. We do have balance among people. Some of the people who had very low levels of water debt balanced between the control and the treatment. And we wanted to really focus on residential customers. So we that's the reason that we cut water use at 500 cubic meters. People in Nairobi pay their water bills and they get their water bills through SMS on their phones. They get it from a code that says NRB. So we used right? I think that's right.
It's NRB water.
NRB water. We got a slightly different code, NRB_water, so that we were sending messages again in partnership with the water utility. So don't think that this was a surprise to them. They knew about this and supported it. But the point here is that the customers probably didn't notice the difference and thought that this was coming from the utility. So this is a way to make sure they were taking these messages seriously. We sent them for 6 months, and then we observed their payment behavior over the next 6 months. We have 3 outcomes that we are defining. Do you make any kind of payment at all towards your water bill? That's pay any. Do you pay the total bill due in full? That's within 10 shillings or so. And then your total amount of water debt or arrears. Okay. And this, I wanted to mention, this study design was pre-registered. So we pre-registered these outcomes. We pre-registered the treatments, all of this stuff. We put our marker down before we did the study. So here are the 5 treatments that we used. Preview, we don't actually see much difference between these 5 treatments. So I'm going to go through it relatively quickly, but I do want you to see what they saw. So here's the first message they saw. Dear valued customers, most customers make a payment towards their water bill on time. Please pay before the due date. So this is a descriptive norm, and we drew these messages based on a whole lot of studies in electricity conservation, water conservation, tax compliance. These kinds of nudges and information treatments are widely used. An injunctive norm, most customers think it's important to pay. So you're describing the norm in the first one. Now you're saying what we think is a norm that the community has. Then a message about, well, we need the money for improving service quality and extending service to those who need it. A message about reminding them about, I'll just highlight the last sentence there, that when there are repairs, as there had been a repair the year before, we need money to repair the pipeline. And then finally, one that was a prompt that included public health. Good hygiene is essential to public health. The utility needs regular revenue to continue providing water. So those are the 5 messages that we sent, the 5 treatments, 10,000 in each group and an equal sized control group for each of these. So it's a large study as well. This is a straightforward randomized control trial. This is straightforward difference in difference methods. So we're looking at the average treatment effect. I'm just putting these up here. We can come back to them, but there's nothing very, this is all pretty standard stuff. And then we'll look at treatment effects by the treatments. So here's a time series graph showing on the y-axis the percent of people who make any payment at all. The dashed line is the one to try to see if you can spot in the colors there. That's the control group. So of course, how we draw the axis, we drew it from 50 to 60%. It makes it look like these swings are wider than they are, but the point is that it does vary. The amount of people, even in the control group, who are making some payment varies over time. So that's the first thing to notice. The dotted vertical line is when the treatments began. So to the left is the control period, the pre-treatment period. And so the fact that all these lines overlap each other means that our randomization worked, right? That the treatment groups are mostly following the control groups pretty closely to the left of the dotted line. To the right of the dotted line, now, if the treatment worked, we should see these lines diverging from the dashed line, the control group, and you really don't see that. So before I show you statistics, you can look at this and kind of see receiving any treatment. None of these treatments looked like they drove, it's a little hard to see, granted, drove big differences from the control group. So now I'll show you the statistics. Oh, sorry, one more measure, similar thing for one of our other outcome measures. This is the percent of people who are paying their bill in full, their total current bill. Again, same pattern. To the left of the dashed line, we see pretty good balance on randomization. To the right, we don't see big differences of receiving these messages. So here's the statistical results. I'm highlighting the interaction between getting any of these treatments and the post-treatment period. So that's the average treatment effect. That's the only one you really need to focus on here. So for paid current bill due, that is not statistically different than zero. You'll also notice a whole lot of zeros in the standard error, meaning it's a pretty tight standard. It's a tight zero. This isn't a small study. This is a pretty big study, and we really don't see much of an impact on making any payments or on paying your bill in full. But we actually see a perverse impact on water debt. So this is interpreted as the causal impact of receiving any of these messages. The arrears actually increased. That's only significant at the 90% level, and 100 shillings is about $1. So this is not a big impact, but it's the wrong direction. So you could stop here and say, these messages didn't seem to work. They didn't really help with payment behavior, and they made the arrears actually a little bit worse. But the story continues a little bit further. Oh, sorry, one last thing. This is another way of showing you the results. Rather than showing you the table of statistical results, I'm plotting the coefficients. So the red line is 0. So if something is statistically significant, that the confidence intervals are what you see in blue. They shouldn't be touching the red line. So if they're to the right of the red line, it has a positive statistically significant impact. If it overlaps with the red, it's not statistically different. So this is showing you the results by treatment letter, 1, 2, 3, 4, and 5, for our 3 measures: paying on time, making any payment, or your water debt. So here again, you can see this weekly significant positive impact. Water debt goes up, getting the first and the 4th message. Okay. But the story continues a little bit more than that. So now let's think about conditional average treatment effects. That means look at the impact within a certain group of people based on their arrears behavior. So we're going to split up. Remember, I told you that we randomized within baseline arrears. So take the people who had the lowest baseline arrears, the lowest water debt over the 6 months prior, split them into 10 groups, into deciles, and we're going to interact those deciles with our average treatment effect. Before I do that, I'll just show you some pictures again so that you can visualize these results before I show you the coefficients. So this is decile 2. So if you ranked everybody in terms of their water debt, this is people who have the 20th percentile to 30th percentile. Pretty low water debt. So if you pay attention to the scale, here's 0. These people are actually on average have balances with the utility. They've overpaid their bill and they actually have a negative water debt. They have a balance. Again, randomization looks pretty good here. Here's where the treatment started. And now you see the lines do diverge. The treatment group getting any information treatment, they have lower arrears than the control group in all of the 6 months afterwards. So if you're in the lower 20th decile, it actually did seem to work a little bit. Here's the 4th decile, 40th percentile. Again, pretty good randomization because we did that by design. Again, you see the lines diverge. This is a lower than the control group, which means arrears were lower. So in this group, again, it would appear from the visual evidence it worked. Here is the 10th decile, the highest. And again, pay attention to the scale. Now we're talking about 20,000 to 30,000 shillings in debt. That's $200 to $300. A little bit potentially problem with the balance here, but look here, now the red line is on top of the blue line. Arrears actually got worse. Among the people who had the highest water debt, getting any message made their arrears go up, made it worse. So those are 3 pictures to motivate these coefficient estimates. So now I'm back to plotting the coefficient estimate from a difference in difference model. This is the average treatment effect interacted with the decile. So up here we have the people who had the lowest water debt, down here the highest water debt. And you see it actually lowered arrears for most people, but the statistically significant positive impact is driven by these people who have really high water debt. So when you're already really behind on your water bill, getting a nudge to pay actually made you go backwards. Okay, similar story with the exception of that first quintile, similar story for our other 2 measures. It made it worse, paying on time, getting any letter made it worse for people who were in the upper half of the distribution of arrears, but it did actually help for the people in the lower half, similar for paying anything. So I will leave it there. And now that's the SMS study. Now I'm going to turn it back to David to talk about the second study here.
So just a set up here for the arrears forgiveness study. So here the thought behind this was that, people are just in debt. Bill amnesty is something we might try to do to get people back on track. And so what we did is we drew a sample. We had a fixed budget. And we randomly selected customers out of the Nairobi water billing records and paid their debts. Right. So we paid their arrears, zeroed them out. We had a sample of about 875. We kind of did this until we ran out of money, right? We ended up at 875. We had a fixed budget. And so the treatment date was between July and August because there was a little bit of logistical lag before we contacted households, got their consent, got them to acknowledge the fact that this was a one-time payment. The managing director of Nairobi Water was very firm in saying we needed evidence that household acknowledged that this was a one-time payment. And so we made sure we called and got that acknowledgement on paper. So we have that. So the treatment was between July and August, and we're observing them initially for 6 months, but data goes onwards. Outcome variables very similar. We're looking at whether or not customers pay any amount in the prior month, so make any payment while they pay their current bill, and then we look at their total arrears accumulated 6 months post-treatment. So I'll just have you focus here on the stats. So this is it's a standard difference in difference average treatment effect. Right here, we're looking at the outcome there. So as you can see here, arrears forgiveness initially had a statistically significant negative impact on whether or not customers made any payment on their bill. It had a negative impact on whether or not they paid their bill in full. And it also increased their arrears. So that's not a fantastic good news story for those who are promoting bill amnesty. But just to highlight something here, I'm running short on time. So again, same sort of graph here. You can see randomization looks good before. This is our treatment window here. The stats I showed you ended the observation period here. But looking at the data and looking a bit more forward, what you can start to see is while there's a difference here, kind of after we pay their bills and their payment behavior, they actually start to get closer again after that period. So we see that there initially for any payment, we see that they're getting kind of overlapping again for whether or not they pay their full bill on time. And then we see similar trends in their total arrears. So the conclusion from that is basically that we might have done some damage in the short run and wasted money. But in the longer run, potentially it wasn't a long-term mistake that's going to continue to do damage. Still don't think it's policy smart to go and do it. But 3 take-home messages from the study in the minute I have left. The first is that I think sending out a bulk SMS messages to customers of water utilities as reminders to pay their bills didn't work for us, and I think is unlikely to work. And so simple broad-based reminders aren't going to get us there. Our conditional average treatment effects highlight that there might be potential for more targeted messaging. I think the good thing about this is that unlike gender or income, about which utilities know nothing about in their customers, they do know their arrears, right? So they could do some targeted messaging to customers who are slightly in arrears to nudge them to get them to pay their bills. So there might be an opportunity for targeted messaging. And I think overall, it's a pretty bad news story for arrears amnesty, right? Moral hazard is definitely at play in the data that we show. We wasted some money. It may have not done long-term damage, but I don't think it's the way to go going forward. So that leaves us one question to ponder as a group. And that, you know, if as a global community, we're moving away from disconnections being politically acceptable, what do we do to compel on-time bill payment? I think that's still a real puzzle. So thanks very much for your time. Appreciate it. I think we have time for one or two questions. Okay, we have 3 minutes for questions. Ooh, lots of people. Yes, sure.
Thank you. So, I have just a very quick question. Did you, in terms of the people who hold the largest debt on there, do you have a sense of which income, where they fall in terms of income? Is there a statistically significant difference in household income between those who hold the least and those who hold the most?
From this study, we don't have any demographic information. We're operating as the utility. It's 50,000 people in the study. And so.
But the utility typically has some sense of where low-income people live in the Tell us about that.
So there are potentially geographic-based measures as an income proxies. In Nairobi, that doesn't exist. I have spent 10 years working on getting those data from the statistical office and have been unsuccessful.
So the answer is no. The second thing is that in the US, a lot of the utilities that serve low-income households know that this is a problem in terms of affordability, basically, right? Like they go into arrears, the utility spends a lot of money trying to chase them down and pay their bills. They can't, they just simply can't. And so there's a low-income household support program, right? And the utilities really lobby for that. Have you seen, as a result of this conversation with the law school, is there any sort of a conversation with the utility to say, hey, these people are not paying their bill and will never be able to pay their bill? What are you gonna do?
Yeah, so we haven't shared these results with the utility. Yeah, these results are except the co-authors, but with the management of the utility. And so this is a conversation we will be having. Right now, they don't have a targeted bill payment forgiveness program, bill support program. Yep. Jill, you can choose the next one.
Maybe in the back.
So I've done some similar research in the UK, because in the UK you can't be disconnected from the service provider. And I found that within the water sector, there's this kind of mix on narratives around customers who deliberately don't pay their bills. But yeah, my research has shown that's not really the case. Like there's no incentive for customers not to pay bills. All that does is, you know, increase stress on them and reduce their ability to budget. So I think really the issue is systemic, and if the services are for quality, then have an optimization and target affordability, but target incentivizing payments through improving the services. So I think maybe your emphasis should be on the individual customers, but on the system itself. And that would improve payment and more than targeting.
Thanks for this comment. We should talk more after. Yeah.
Yeah, just on the point about socioeconomic groupings, there are some kind of global data sets out there at the moment that might be of interest. I mean, the World Bank has a lot of that policy information and things like that. But there's also spatial data sets like Luminous and some estimates that might be helpful for you, and then you could do some kind of incorporate those into your analysis if you were interested in doing some socioeconomic comparisons. And then on your presentation, on one of the slides where you have like initial statistical table, there was one with very significant results, and I'm not sure what it was. It was just below. I mean, I just saw these like, for example, I wondered.
Oh, I think it's the time trend, or
Okay.
yeah, I think the post was statistically.
Right, okay.
So there was a time trend between the treatment period, those 6 months were statistically different than the period before
Oh, I see.
among the control group. That's how you would interpret it. I think that was the one that's statistically.
Okay, right, and then back.
We have time for one more question.
Maybe.
So not a question, a comment. So first, thanks for this interesting research. I think it's kind of just bring to the forefront what we've always known, right? That in a lot of countries, there's now a culture of non-payment of water services and sometimes electricity as well. But then that's also because of the history around poor water services. So even if there's an improvement in the surface, what's already lodged in the minds of customers is you're not being trustworthy. But couple that with the fact that a lot of households are actually exiting from formal systems, people are drilling their own wells, people are, selling water, etc. I don't think it's something that can be addressed by just targeting those individuals. And I really just want to second the comments that were made by the other speaker, that is a system that needs to be addressed. So talking to the utilities, the regulators in those areas, the policymakers in those areas, to really figure out how you can have this conversation with customers. And I think there are some examples that can be drawn from the regulator in Portugal, ERSA, who in the 90s, they actually are quite open that people would not drink tap water in Portugal because it was not safe to drink. But then there was a nationwide concerted effort to actually improve those services. And so I think in trying to tackle this question, it's not just how do you get customers to pay, but how do you reinstill confidence in public services in a lot of this country.
And in the US as well.
Yeah.
100%.
So I'd like to thank the speakers, brilliant presentation. So next one. Dr. Kalimuthu Arumugam, did I say right?
Yeah.
He's gonna talk about closing the loop, transforming fecal sludge into green fuel as an alternative of charcoal.
Good evening, friends. I think this last presentation of the day, I guess. Not only that, maybe last presentation, the verbal presentation of this year UNC conference, I guess. Right. I'm from an NGO. I'm going to share about the practical problem what we faced and how we are locally try to address that problem. That's what I'm going to share the little story about. So we all know, if you know that, but India, almost 60% of our households use on-site sanitation, but mainly septic tank and pit lettings. And most of the cases, the desalinating services, most of the cases, the people involved in sanitary desalinating services, they don't use proper PPE and things like that. And also most of the cities, there is no treatment plan. So maybe if you desalate your septic tank, you have to dump somewhere in open environment or water body. That's the major issues. And in addition to that, so maybe we don't have a standard for, maybe we have a standard for effluent disposal, but we don't have a standard for sludge disposal. That's a problem not only in India, maybe in other countries as well. So I feel. So to address this issue, most of the cases, there is no facility available. There is no treatment plant available. If you analyze the septic tank, almost 95% of the cases, the septic tank is contained liquid. Why someone need to transport the liquid all the way to? Why not we tackle the problem on the spot? That's how we came up with the solution. That's a mobile septage treatment unit. This is a STP on wheel. So I would say that. So that's what we assembled, and maybe it's a small. The capex is very minimum, and operational cost also very minimum. You are not transporting anything to the treatment plant or maybe away. And in a day, the MTU can desalate 3 to 4 tanks. So it's the capacity of the MTU is about 6,000 liters per hour. So the multiple advantages. So what it does actually, the solid liquid separation, liquid get treated on the spot, sludge get collected in the vehicle. Then finally at the end of the day, you carry the sludge to the treatment plant, or maybe you go for a secondary composting, or maybe briquette making. So this is how the whole operations. And this technology is completely, it's vetted by the performance assessment was done by international institution as well as India. Finally, it's approved by the government of India now. The government is funding for the state to buy this technology. If anyone interested, maybe we can sideline, we can discuss about this one. We are an NGO, we are not a marketing agency, we are NGOs. This research project was supported by Bill and Melinda Gates Foundation. Yeah, so now USAID is supporting us to commercialize this technology. That's how the whole thing. My problem is, so once we are handling the liquid, 95% of the liquid get treated on the spot. but still the 5%, the sludge. Particularly, this is the problem. At the end of the day, you collect sludge from the MTU, right? On average, our experience, whereas regular septic tank which desludge regular intervals. Maybe if you have 6,000 liter septic tank empty, on an average, we collect 40 to 60 kg of sludge. Maybe the septic tank is not desludged for about 10 to 12 years or 15 years. Then the sludge accumulation goes up to 180 kg, 150 to 180 kg. That's a quantum of sludge we collect. What to do with the sludge? That's what the thing. So what we did maybe, so at the end of the day, so why not we convert them as a briquette? That's what we did maybe. So dewatering the sludge, then maybe then heating it, then mixing with the different components we tried. Finally, we tested how the calorific values vary. So we have tried with the different components, particularly fecal sludge with cow dung, fecal sludge with sawdust, fecal sludge with cow dust, coconut shells, dry leaves, charcoal, and fecal sludge alone. So different combination we tried. So what we found, this is the results we have got it. So you can see that maybe if you go for fecal sludge alone, the calorific value is 2,300, that is 59. So maybe if you go for, so out of all these things, fecal sludge plus dry leaves gave a good results. It's almost compared to charcoal. Charcoal is 3630, it's better than charcoal. So most of the cases, what's happening, the tea makers or the people doing ironing work, or maybe the hatcheries, people use charcoal a lot. Maybe the cost wise it's lower, and maybe so it can be a better alternative for charcoal usage like. So we have tried. So what we tried, maybe we supplied this charcoal with the briquettes with the dry leaves. It's a different tea shop. So try to use it and how you are making, how the benefit like. So what we found, on an average, we see if you use gas to prepare on an average or tea, if you want to make a tea for the 1 kg or 5 kg of gas, if you use, or 4 kg of gas, if you use, you can make 350 glasses of tea, meaning 100 ml each. So that costs around 0.89 paise. The same place, if you use charcoal, it costs around 0.85 paise. Whereas if you go for fecal sludge with dry leaves, the cost around only 29 paise. So maybe you can see the cost comparison. So maybe that's a better all. So not only that, and also we have tried with hatcheries, right? So particularly for the chicks, they wanted to keep for first few days, they want to keep in a warm condition. Most of the hatcheries, they use high power lamp or the charcoal based one. So maybe this can be a better alternative. So again, the cost savings, you are not, environmental pollution is not happening. So in the case of using high power lamp, then you have electricity and all those things. And charcoal, how it's coming from the wood, and maybe you are burning the wood like. So compared to all those things, it's freely available. Most of the STPs, the fecal sludge, treated fecal sludge available, no one is ready to take it because of the transportation cost. Even though they're freely available, government of India giving free of cost for all the farmers, but most of them are taking it. So maybe this is a better option to convert fecal sludge into proper fuel. That's what our findings. So this is how the different trial we have done. This is a tea shop. We have tried maybe the boiling water. Another one is keeping warming, keep the warmness for the chicks in the hatcheries. Another one is for the iron box. Every street in India, if you see most of the towns, the people are available to press your clothes like. So maybe there also maybe it's a better alternative. So they all use charcoal. So maybe this can be a better alternative. That's what we found. This because we are from an NGO, we didn't go for a very detailed the research based analysis. That's what our practical finding. So most of the case, what we found that creating awareness. Maybe the moment you say that fecal sludge, it's fecal matter, like it's coming out like that kind of the feel is that. Maybe we need to address that one, creating awareness and going for a proper marketing will maybe the fecal sludge with fecal sludge can be the better alternative for charcoal or maybe the gas usages in some of the cases. That's our finding. So thank you very much. Any questions, please? Yes, please.
The water, when you said, this was on site, right, you empty this up, where's the water?
See, actually, so because we can use it for the garden, because it's meeting Government of India standard as well as international standard. If it is in case garden is not available, you can put it on the drain also, open drain also, because it's meeting all the standards. So because we are not carrying, so because we're carrying, imagine, so even if you assume there is a treatment plant available in the city, and always the treatment plant located away from the city, almost 30 to 20 to 30 kilometer away. So then most of the cesspool capacity is 3,000 liters. You have to transport. If you are emptying 6,000 liters, you are twice you are transporting. The fuel you are spending, maybe carbon emission, everything you can calculate. Whereas here you are treating it on the spot. So maybe you can use it for a garden, secondary uses, or maybe you can leave it in the drain because it's meeting the standard. Yeah, it's thoroughly evaluated by Duke University, RTI, IIT Chennai. Finally, Government of India approved. Government of India is funding for the state to buy the truck. So now it's almost we are in the commercialization process. Yes, ma'am. So this one is something around maybe I would say that including the truck, so around $40,000.
How much is cost the house space?
House space. Okay, so maybe if you hire a cesspool truck, so if you ask a cesspool truck to transport or maybe empty your septic tank, so 3,000 liters they charge around 1,500 to 2,000 rupees. Whereas our case to treat 6,000 liters capacity of the septic tank, it costs around 800 rupees. You can imagine. Yeah, so that's a variation. It includes 3 years replacement cost for all the spares. Yes, sir.
Can you comment? So you're talking about maybe a fuel switch choice from charcoal to this biochar, Faecal sludge. Have you measured kind of emissions off that? I mean, everyone's worried about climate right now.
Yeah, so maybe, so what we are saying that when you compare to, because when you are making charcoal, you are burning the wood and maybe you are making as a charcoal, again, you are using it at the time of also burning it, right? 2 times happening. This case is 1 time. So we need to calculate that emission level. Being an NGO, we didn't have that kind of bandwidth to do that. So what we found is it's a better alternative. Maybe someone maybe the research institution can take up further studies, you can go in depth. So what are the possible alternative options? Because what we found that is the cheapest option, cost wise, and also environmental pollution wise also, it's comparatively should be lower. That's what our understanding. Yes, sir.
What about smell? Is there any odor when you burn the?
So we haven't found anything. So during the study, yeah. Because you are already burning it and maybe you are mixing it, grinding it. So it's a pass through the process. Even after doing that, it's cost wise 1/3 of charcoal cost.
When you burn that pellet, then it goes home.
No. Yeah. Okay. Thank you.
Currently, I'd like to invite all these speakers to here to the front so we can get more questions. So we still have 20 minutes. So that's the opportunity to make all the questions you were able to do before, but now all this time for questions. Okay, please. So who wants to start? Yeah, the back.
I have a question for Christine. You compared the different poverty indices and metrics. Do you have personal preferences from all your studies of what you think goes into the poverty?
Yeah, I get this question a lot. It's like picking your favorite kid. I would say so. I hope this is on. My biggest takeaway or my hope for the biggest takeaway is that it doesn't matter what I personally think, and it really matters what your organization or what your initiative is really hoping to accomplish, or the impact you expect to see, or the types of target households you're hoping to get. I will answer your question and use this opportunity to say, I think one aspect of poverty that folks don't talk about enough, in my opinion, is the dynamic nature about poverty status, right? That in this moment or in this month or this one period of time where we're measuring your poverty status, you could be sitting at one level and then a dry season comes, or your crop harvest fails, or the rains come late. And you're actually experiencing drastic changes in your well-being that we don't capture when we measure once every 2 years or once every whatever years. And so if there's a way to think more about the dynamic nature about well-being, I would say that's a really missing opportunity that I personally subscribe to a lot. This idea of like, you're on the top of a hill and you could fall off at any point because of an instability. None of the measures we looked at were quite good about that. And I would say in general, if there's one area that you want to look more into, that's what I would advise. But again, my definition matters less than the one that you and your organization subscribes to. Does that make sense?
Next question. Oh, if nobody's gonna ask, I'm gonna take my, now I'm not the moderator, but someone in the audience, so it's also for you. So you showed you mentioned the $2, but did you compare, so your results with this $2 profit line and see if they match or not?
Yeah, so anyone who's worked with, you're talking about the World Bank, $215 a day.
Yeah,
So we consider this, but the World Bank's consumption expenditures module is incredibly long. So when I worked with the World Bank, we piloted a study, and that first initial pilot took 4 hours with the household because you're documenting everything, right? Like amount of rice they've eaten, amount of whatever they eat. So in this particular opportunity, because we wanted to compare multiple, we didn't have the chance to do that holistic assessment. What we did instead was look at consumption expenditures, food, transport, and airtime, and look at that from a relative comparison. So we're getting some part of that monetary aspect, but not the 190 or the 215 that everyone's using. Does that answer?
yeah, no, but my question actually is about revenue. So don't look at how much the income. You didn't compare the monthly income. So if you get less than that, you're poor. You didn't look at that.
No, we didn't set a threshold because we're only asking for a subset of their expenses. We weren't sure what that threshold should be. Does that make sense? So if you're asking me for food, transportation, and clothing, and we only mentioned food, we don't think that $2 should be the same threshold that you use for both. I don't know if that answered your question, but happy to talk more offline.
Okay, yeah. Next.
For Joe and David, for the USA Wash Bin Project, we helped the city of Cape Town with their customer service turnaround project, which was looking to increase revenue collection from 75% to over 90%. And one of the key things that we looked at, there was a McKinsey study that came out like 5 years ago, and maybe longer now. COVID memory, right? That looked at trust in public service agencies and how improving customer service and like having a positive experience of your interaction with that agency increased your level of trust, and by corollary, maybe your willingness to pay or ability to pay. They said that in their rankings, like tax agencies perform kind of equally as well if they improved their customer service. People had even a higher level of trust than an agency that would provide you the services rather than try to take your money. Kind of counterintuitive. But building that level of trust. So trust for improving payment, and then also like just reducing barriers to payment, creating, so you don't have to stand in a queue to make payment. Or trek to the payment office. So things like in Nairobi, where you've got mobile payment and rolling that out or making that easy, has been found to improve payment rates.
Yeah, I guess I would just react to that in concert with the earlier comments. I mean, you shouldn't, I guess, misinterpret our research to say that we think everything should stay the way it is. And let's just see if we can nudge people to pay their bills. Of course, the utilities need to work on improving their service quality for sure, right? It might be hard for them to improve their service quality without more revenues. So it's a chicken egg, the old low level equilibrium trap sort of problem. How do you get out of it? So we just wanted to sort of test whether these tools might work. Building trust is another one that I'm sure the utility is very interested in and routinely measures and is working on building as well. So any number of dimensions that probably go into people's feelings of goodwill towards the utility, towards the service they're getting, make it more likely that they're going to pay the bill But, I guess I would say one more thing, come to the US. We, in general, many people do have pretty high quality services that they're pretty pleased with. Many people do have relatively high feelings of trust. And it's an open question in my mind that if we remove the threat of disconnection, whether those things, high service level and trust, will be enough to keep people paying. I don't know the answer. I really don't, but I don't think we should assume that it will. There's a danger of us falling into the low level equilibrium trap in high income countries with relatively high levels of service.
I totally agree with that, but in fact, we saw that in the city of Cape Town during COVID disconnections. We saw it significant. We made considerable progress from kind of 19 to March 20. And then had a significant drop for a 6-month moratorium period, and then they brought connections back in and continued that upward trend. It was the real differentiator was exactly what you said, the disconnections. So.
On the back. Assume the last, yeah,
Actually, I'm gonna say the same thing.
okay. So you're here.
Yeah.
Sorry.
Christine, I absolutely love the presentation. It's really just a clarifying. So we use a lot of DHS data with doing economic modeling. So this is really eye-opening. I was curious if you had a chance to look at sort of the relative wealth index and the work that Meta has done. And I know they also build on DHS data sets, but they also combine that topographical and satellite data, and they have an algorithm that combines a much more larger set of both spatial and non-spatial data libraries. So I was curious to just hear your point of view on what you, I fully acknowledging that finally there isn't a single method. And we want to, I would love to get that, and then a follow on the AK, and I'm happy to just, AK, thank you for that amazing presentation. I just was curious, how easy is it for a local, let's say a truck manufacturer to do something or build something like that domestically? Like what does it take to manufacture an MTU? And can it be done easily in a domestic context? I just love to hear your thoughts on that. Just provide a
Yeah, so it's because except TSS sensor, rest of the material what we use in the MTUs off the shelf, it is available local market.
Okay.
So easy to manufacture.
Okay.
So only sensor in case you wanted, because we have installed a sensor, because performance monitoring is critical. Whether it is, how the, consistently the MTU is performing like. So only the sensor is imported, rest all of the shelf. It's easy to manufacture. Yeah. So.
Thank you. Thank you.
To your question, we're talking about just the satellite imagery, machine learning methods.
That Meta and Hercules, but yes.
Yeah, I'm really excited about the types of convenience that those types of methods can offer of increasing information that we have about kind of the dynamics we're talking about. Sometimes I worry about error propagation, right? Like those algorithms are only as good as your input data. And if your input data aren't measuring what you think they're measuring, then you're probably not predicting what you think you're predicting. So for the individuals that are inputting DHS wealth indices and using that to think about poverty, I really would question a little bit whether you're predicting health status or poverty status. I don't think that the algorithms have to change. I just think that the input data they're using to train their models could use a little bit more thought into how it aligns or doesn't align with the types of households they're trying to identify. I'm not sure if that answers your question, but overall, just wanting individuals to be a little bit more thoughtful about what are the models that we're building actually predicting. I think sometimes I see individuals putting in a bunch of variables and getting one index out of it because they don't want to choose, and it's hard to choose, right? Like, do we put sanitation in? Do we put water in? But that shouldn't be an excuse to say, well, let's put in 150 variables and see where it comes out into, PCA, and then let's use that going forward. I think we should say, what are we actually interested in? Are we interested in water access? Let's measure that. Are we interested in money? Let's measure that. Are we interested in like self-perception of well-being? Let's directly measure that.
The back can ask you. You first.
I think this is a question for Christine. Sorry if this question is asked general or redundant, but when you do a good research on topic of measuring poverty and look at a literature review, how much different do you think your conclusions are from the conventional discourse on measuring poverty on academic, or like how much do you think, or how much of it do you think that just converge from the discourse?
I don't know if this is what you're trying to get at, but I do notice some patterns between disciplines within academia of the favorite measures they use. So public health will often use DHS. I think economists will often use consumption expenditures. The World Banks will use the 215, and then the UNDP will use the new multi-dimensional poverty index, right? So there are all these different schools that they love their favorite. And then you can go to the field and actually speak to households. And when you talk to those households, what they really care about, in addition to the money, are things like dignity and happiness and agency. And I'm not saying that those are easy things to measure. I'm not also saying that we should just swipe the whole field and focus on those, but acknowledging that if we're coming in and we actually really want local empowerment and contextualization, their definition of poverty is probably going to be a little bit different than what folks in DC are thinking, or folks in Stanford, wherever you might be, right? And I understand there's a feasibility component, right? It's not feasible to use participatory approaches all the time, but it's more matching your purpose, the communities that you want to target, and really the definition, right? If you come in and think, I want my community to know and think about how they are relatively ranking, use that instead of what the World Bank is doing. But again, I understand why you want time comparability and location comparability. There are real trade-offs. I'm not saying it's easy, but I just want people to think a little bit harder about that before they pick one. Is that helpful?
Yeah. I have two questions. First, about nudges in general. I think, I don't know if you were talking about willpower, and that's like one of the first to talk about nudges. I know it's been replicated, they haven't found those results. I think a lot of people are doing nudges and finding much lower effects than anticipated. My understanding of most effective nudges are the ones that you change and opt in, opt out, so you make switch whatever it is. So I guess my bigger question is, what are your thoughts on nudges for Washington disease or generally? And is this something that we should continue to explore before we over research it? And then the next question I had for Christine in terms of, we were thinking something with the dynamic poverty. I was wondering if I was kind of listening and thinking everyone's just really poor in this context. And different definitions of the act. So like the attitudes of the poor, but really they're all poor. So if you change the metric, you're just choosing different poor people.
I'm gonna let you go first, because I need a moment to think about that question.
Just make one comment.
Yeah, go ahead.
I'll let Joe speak to the general nudges. But in terms of nudges and defaults in particular, so we're kind of spinning up a study with National Water in Kampala. And what we explored doing was encouraging people to enroll in auto pay, direct debit, because I think that is a really potentially effective way. So I had a team out there doing some pre-feasibility work and talking to customers, and absolutely nobody is willing to enroll in auto pay because they do not trust the utility. The same reason I don't enroll in auto pay for water, because I don't trust my local utility. And so we had hoped to do that. I think it would be very effective. I think there's low levels of public trust in some contexts. Now, nudges in general.
Well, I mean, I had somebody who's published a couple of these papers. Yeah, I wouldn't oversell it either. I mean, I often point out when I'm talking about these, on Alcott did one of these studies where they gave people an option. What would you be willing to pay to stop getting these messages? And a significant number of people had a positive number. Please stop sending me these messages. So, I mean, the effect sizes for a lot of these things are relatively small. Should you go to a water utility in the middle of a drought and say, oh, it's a waste of time? No, it's not a waste of time. I mean, the evidence, the reason everybody's so obsessed with them is you can do high quality causal identification, and you can replicate them in lots of places and see what the effect sizes are. So does it have a place if you're in the middle of a drought and you're trying to, 2% savings is 2%. I mean, don't leave money on the table if you're trying to save. But for sure, I think the tide is moving out on them. I think academically, people are getting tired of them. And the small effect sizes are, making it a little less interesting for policy, but they still have a role. And again, to defend our study, I think it's a question. I mean, if you can't disconnect people, can these play a role? And I think it was worth doing the study to show that it's not having that big of an impact, particularly on those people who have the highest level of arrears. Yeah, sorry.
No, that's all right. So I think there were two parts to your question, which I think are very good and fair questions. Let me start with the dynamic. I think we measure poverty for a variety of reasons. One is to monitor progress. And the other is to try to think about why are these things happening, right? Like, why do we see certain persistent poverty or transient poverty or whatever you want to look at? The reason why I think the dynamic distinction is important is there are different reasons for why some people escape poverty versus fall back into poverty, right? And making that distinction allows us to think about the types of policies that should be geared towards different types of individuals. So in that particular case, we think about the causal mechanisms and think about how can we be a little bit more effective with our policies and money and distribution. That type of distinction matters. On your point that everyone's really struggling or vulnerable, I think that I'll counter that and say, I think relative poverty can be just as important. So thinking about certain places in the US, I come from San Francisco, a very wealthy area with incredibly high rates of inequity. And I think what relative poverty and that line you would set in San Francisco is far, far, far higher than the absolute poverty line perhaps that you would set in other emerging economies. I think both matter. I'm not here to say which one is better. I think we should work on all of it. But in terms of conversations about prioritization and also conversations about being relatively included and just social inclusion in general, you know, I think that's where you would think about the differences between setting a relative versus absolute poverty line.
Who's next?
I have a question about the mobile treatment units and just thinking about rural communities where maybe they're pretty drivable. I'm from the University of Alabama, so the Black Belt of Alabama is where I'm thinking about. And maybe the feasibility of having a service like this almost to operate like a garbage pickup or waste pickup kind of service, maybe what the feasibility of that would look like maybe capacity per day for one of these trucks, what they're able to handle.
Yeah, so there's a truck capacity, as I mentioned already. So 6,000 liters per hour. Yeah, so maybe most of our experience in India, most of the household septic tank size is vary from 6,000 to 7,000. Only the community septic tank sizes are bigger, but most of the household septic tank sizes within 1 to 1.5 hours you can empty them. So that's what on an average the empty can do 4 to 5 tanks in a day. So that's how maybe. So at the end of the day, only sludge get collected because you are leaving the water after treated water, you are leaving down the site. Only sludge get collected. So that's it. Yeah. So maybe it's easy to use. That's what maybe the government of India recognized. Now almost all the small towns where there is no treatment plan, even peri-urban area. Now the government is funding to buy these trucks. That's how the things are happening now. Yeah.
Nice. No. Okay. So I have the last question. As a moderator, I have this right. And I just wonder if the water utility in Nairobi is going to allow you to do any other experiment there after the arrears increased with your experiment.
So that's a good one. You know, they've been longtime collaborators of ours. I think since 2015, we've done research that they've used for policy. They have many people who are pursuing academic degrees in management. I think they're game to test interventions that they perceive that might be policy relevant. So I think they're going to be great partners going forward.
Okay.
Yeah, so I think I'll be okay with it.
Okay, so thank you, everyone.
Thank you.
When you show the global numbers, the correlation coefficients.
Yeah.
For all countries, it was negative, but when you plotted the individual countries, they were all positive.
Talk about the district.
Yeah, when you plotted the.
With the urban and rural separated.
Yeah, but none of them were negative.
None of them were negative, I know, but
Except for
the
the all,
combined
yeah.
were
What's
negative.
going on there? Okay. I didn't want to ask her in there.
Oh, hi, you know, it's nice to meet you.
I was just like, I saw you last time.
I-
When you presented something like that.
I'm going. Thank you.
I have 6. Yeah.
So that's why I'm wearing the mask.
Were you here?
Yeah.
Larry, oh, thank you.
You have a private.
Oh, thank you. People have to find.
I think.
I'll just.
What they're going to hear, right? Including whatever.
Thank you, sir.
Thank you.
We did, there in, Pillai.
The water, this is the water for 7% of the planet, where the water.
I just love the idea that stop.
Yeah. You know which paper I'm talking about?
I didn't know about
It was one of those oak power.
I know those.
We should have done this.
Yeah, Alcott and Rogers. Alcott, yeah, did all the oak power stuff, but yeah, he did this one, and then, so then he called, I forget what term he used, but it was basically like the opposite of a moral tax. It was like making you. It makes you, yeah, it makes you feel worse being reminded that you're doing work. So you talked about it in the paper.
It's worse than that. There's so many misinformation.
In review right now, so I'll send it to you when it comes out. I do have a copy.
Yeah, right.
What was it?
So that's the thing we have. Yeah, let me explain my plan. And then my idea is to compare increase comparing operations when they privatize. So one of the things that people say when they privatize, they don't go to the I hope this is like yes, everyone expects receipts of the minimum wage. All the old who has the average income of minimum wage per person. That's the threshold for being. And I want to have this data set with that. And I want to use that, those are the poor, you know, so I want to compare the speed of Madam Luciana, am I talking to the right one? Can I say that they are the poor, those that on average, each person gets, so person gets half of minimum wage. So, minimum wage, that's why I'm talking and that's the one that I have to make.
But again, I don't think you then follow that up with a, oh, I think it's still. You're gonna put it back on. Okay.
Yeah, the only thing, my third line would be 2020 because of COVID, and because of COVID, they expanded without any criteria. Because people started lost their job, lose their jobs.
Something you saw in this. I think what you're talking about, I don't want savings, but we have everyone got it. I'm not sure what it made by you, but it's like random. For different. Be able to exploit that change, say, what happened, if given me a target versus individual. Next, I don't know, that seems really interesting. I mean, I don't know that it's happened either.
No, it's the opposite. Brazil lives everything online. Everything, just go on. You need to know Portuguese. You need to have someone who speaks Portuguese to help you. My kids are working in the federal government, so I also have some access that people don't have there, you know. But mostly, this data set I'm talking about is from since 2012 to 2019, so 7 years, 9 years of data. Yeah, let's see. I find that it will be the same. There will be no certificate content. That's my. Yeah, my works look at the impact of the privatization in the last 20 years, and we can see if it was improved in those places. Yeah, so we're gonna have lots of questions, and one of them is if it increase coverage, right? And if this increase reach the people.
You don't think it's no.
No, I think it's my guess is increase both faster than that. But my guess is that there's no difference between Israel and my guess. But why is that? Because they know all those contracts. So they have to reach some goals. So that the contract says you have to have a coverage of 99% after 5 years. Just guess. They do not have too much place to go. They have to go to the poor because the rich are already covered when they privatize. Right? It's just my point. So that's what you know in the country, you know. But so I think it's true. Yeah. So maybe that's my poster or the next thing. I was there to talk about that. Yeah, I got a poster here. But they put it again today because as I'm in the War Institute, every time someone doesn't show up, they put hours. Yeah, I don't even know where.
I'll go behind it.
Yeah, and that shows that just look at money, how much they invest in capital expenditure. Just capex, only that. I'm not saying that coverage actions, no, just money. On average, they invest more than 4 times the private sector invests more than 4 times than the public sector in Brazil in the last 20 years. But when you look only for those cities that are transition from public to private, the difference is 20%. It's still higher, but it's not that. And why is what's going on? And I cannot say that because I run the data, but I didn't really run any statistical model for that, so I can't. But what I saw was that most of the cities that privatized they were not higher level of investment. What's going on? Because it's random. The decision to privatize in Brazil belongs to the mayor. So it's not a national policy to cherry pick the best cities, you know? Yeah. And then you also have not their large cities, but they have very small cities that privatize. It's not because they are wealthy, but they have 2 cities that privatize. So that's something that.
I don't like it to moderate yours.
Yeah, maybe. Yeah.
I'm really curious.
Okay, yeah. Thank you so much. Thank you for
And